Thanks for having me. Excited about this conversation. Jitesh Ghai, CEO at Hyland. Hyland is an enterprise software leader in the space of content management, all things unstructured data. So documents, images, medical images, PDFs containing all sorts of different information. We are the trusted custodians of this mission-critical unstructured data for healthcare payers and providers globally. Over 14,000 customers rely on us globally. 14,000 enterprises rely on us globally to ensure that their mission-critical unstructured data, enterprise content, is governed, it's secure, and the right people have access to it. Hyland takes this foundation of unstructured data, mission-critical data within an enterprise, and with it, we securely then automate mission-critical business processes for an enterprise. Patient onboarding, patient referrals, intelligently processing documents, extracting, classifying. We're over $1 billion in revenue. We're the biggest at what we do, and we're very excited about the kind of innovation we'll be delivering over the coming months to radically revolutionize and change the healthcare space.
Fascinating. And so great place to talk about it is here at HIMSS. And I know Hyland's been around for a long time as well, too. So you've probably seen quite a few versions of, what innovation looks like with the technology that's available to the ecosystem. But, at an exciting time right now, I'd love to hear from you about, I guess the current state of play as you're having conversations with providers and technology partners here at HIMSS and what's really exciting you at the moment.
Yeah, everybody, the industry always talks about connected care experiences, connected data, yet data continues to grow, and 75 to 80% of it, especially in, paper-heavy, regulatory-heavy industries like healthcare, 75-80% of an organization's data is enterprise content, is unstructured data. So it's growing, it's fragmenting, which is a direct odds to delivering connected data for connected care experiences and outcomes.
Yeah.
That's an incredibly difficult, but incredibly exciting opportunity to deliver radical value. Everybody talks about the AI part. Well, the AI is only as good as the data. And really the most mission-critical data is the unstructured data, the patient records, the provider records, et cetera, that enable an AI to then help organizations be more autonomous in their decision-making.
Yeah, interesting. And so it's interesting, too, speaking about the AI and, there's various iterations and applications of generative AI now, but there's other kind of ways that it can be applied practically and usefully within healthcare rather than just done for show and tell. I'd love to hear about how you think about the practical application of AI in healthcare. I think you already touched on a fair bit of it then, is that it's not so much about the algorithms, it's about what's behind it in terms of the data.
Yeah, what makes us unique in how we serve our, 14,000 customers globally is we have a deep understanding of their unstructured data, but we also have a very deep understanding of the mission-critical business processes that rely on this unstructured data, whether it's processing claims or ensuring that we're getting patient acknowledgments and that all the paperwork is signed and completed, all the mundane things that, frankly, technology should be automating. We've got a long history in building out business process-specific workflows that historically have driven collaboration amongst humans to drive an automation outcome for an enterprise, but now should be agentic workflows. Now should be AI agents that just do the job. The exciting job of enabling a radiologist to analyze images and get to clinical care outcomes faster for a patient. But equally the mundane, the industry still operates on faxes. There's folks here talking about faxing.
Yeah. New way to fax.
taking a fax, taking the content in a fax, digitizing it, but then separating the pages, classifying, thousands of pages within one PDF file into different documents, separating them intelligently extracting the relevant, salient information within those classified documents and delivering them to various systems across a healthcare provider or payer.
Hey, you touched on agentic AI and the use of AI agents, and I know that's depending on where you are across HIMSS, that's certainly a hot and interesting topic, and actually outside of healthcare too, there's a lot of buzz about that. I'd love to hear from your perspective a little bit more about, I guess for those maybe unfamiliar with what that is, perhaps heard about agentic AI and they know about generative AI, like all these different variants of, why is this such an exciting opportunity for us to lean into?
Yeah, it's a great question. It really comes down to, you kind of alluded to it earlier. Everybody thinks Gen AI and they think chat and chat experiences.
Yeah.
That's not where the value comes to an enterprise. The value to an enterprise comes where you're automating mission-critical workflows, mission-critical business processes. Historically, that automation has appeared in the form of bringing various subject matter experts across different departments, clinical subject matter experts collaborating with operational experts for claims processing, invoice processing, accounts payable. That type of automation is bringing organizations, people together. But what agents can help you do is take those workflows and AI enable them, what we call process intelligence. That's what an agent ultimately is a subject matter expert on a specific business process, and the steps of that business process are now AI enabled through predictive models and machine learning, through large language models, extracting the relevant data, but then also making a decision based on that and alleviating the people that have historically been part of that workflow from doing the mundane and focusing on what matters, which is clinical care experiences and clinical outcomes for patients.
I think you started to touch on the answer to what would have been my next question, which is I often think about, and this is stuff we were talking about on chat prior to the conversation too, is that sometimes, or there's a lot of artificial intelligence, I feel like that exists. It's that kind of just because we can doesn't mean we should type thing. It's like, and as you suggest, we already, like all of these existing workflows already exist, but there's humans that are kind of doing the doing and they're interacting and engaging with each other. But one could argue that there's a lot of value that comes from having the squishy humans that are able to be, malleable and not so process driven to be able to then help guide a process through. If you throw up, technology or agents, AI-powered tools to be able to do it. That all sounds like a really cool project for someone to kind of get stuck into and sounds kind of neat. But ultimately, we want to solve problems. I guess that, to your last point, the problem we're really trying to address here is there's humans probably aren't the best asset to be pointing at doing the mundane, consistent kind of legwork when there's a lot more of in a industry like healthcare, which is providing human care. You want to free up as many humans as possible to be able to do that human care as opposed to be stuck in the legwork. Am I on the right track here?
The high value work, exactly right. Why subject very smart humans to the mundane? Asante is a healthcare system out of California that prior to our intelligent medical record document processing technology, as they described it, they had a backlog of literal paper stacks the size, at any given point in time, the size of two, NBA basketball players in height. And it would take them hundreds to thousands of hours to dig through this documentation, which was, ever flowing, ever growing, to get to relevant documents that were actionable. Leveraging our intelligent document processing capabilities, they were able to take what took hundreds of hours and do it in, I think it's about 35, 40 seconds.
Wow.
So, frankly, the biggest challenge I see at HIMSS and in general is everybody's talking about AI. Everybody's struggling. CIOs are struggling with how do I make AI actionable so that it's actually delivering business outcomes? And that's where I think it's not about a chat experience. It's about automating business processes with intelligence, building those agents, and then freeing up these very smart people to work on the higher value things that AI can't do today.
Yeah. Love it. And so lastly, then, here we're kind of in the midst of HIMSS. Any other final kind of announcements or takeaways from a Hyland perspective that you're hoping that attendees and audience of this conversation would have?
Yeah,
well?
if I could leave the audience of this conversation with one thing, it's not about the models. The models is a race to zero game. Everybody talks about their favorite large language model, whether it's from Meta or Anthropic or Mistral, you pick. Open source, closed source, open AI. Everybody talks about the models that are trained on the internet. That's great. Trained on the internet gives you great chat experiences. To make AI secure, actionable, and deliver exponential outcomes, you have to start with your own unstructured data, not some model trained on the internet. But you can leverage those models, deploy them leveraging Hyland's technology against your most mission-critical enterprise data, which Hyland is the trusted custodian of. So anybody looking at embarking on automation, intelligence, and AI initiatives, I'd request that they start with their data, their unstructured data, the 80% of the organization that is so document-heavy, especially in healthcare.